You gonna hold it?
Hi, my name's Sasha. I'm 25 years old and a mother of a 2-year-old, and I have OCD. Do you need poo-poo? Danny needs poo-poo, okay. I think when I changed school, it was a big thing happened in my life, and that made something flare up inside of me, and I started just getting really anxious thoughts about, how could I prevent anything bad happening to those people that I love, and it quite quickly spiraled out of control, and before I knew it, my life was pretty much dominated by counting and obsessively horrible thoughts about horrible things happening to the people I loved. Give Sam a kiss.
Mama.
Yeah, poor Sam.
To understand more about Sasha's condition, I have come to the Cromwell Hospital in London to speak with neurosurgeon and expert in OCD, Dr. Linquist. He explains how modern science is allowing us to understand more about the condition and its neurological origins.
Well, we all have some obsessions. Some people like to check that they have locked the door 3 times. Some do it 5 times. And there is a floating boundary between normal and abnormal behavior in this regard. But everyone would recognize that if you keep washing your hands for 6 or 7 hours a day, this is clearly abnormal, and the patient is suffering. It's of course difficult to accept that it all in basically down to a transmission of impulses between neuronal groups which are controlled by chemicals.
With many long-term sufferers of a mental health illness, their battles with their condition often shape who they are. I caught up with long-time OCD sufferer Sasha for a walk in the Suffolk countryside to see how she would feel about the possibility to eliminate OCD from her life.
I don't know if it really would work. A part of me thinks I think OCD is something you have to retrain yourself. You have to retrain your brain. I think I'm lucky to have had a personality that has got me through it.
What's been the most effective treatment for your OCD?
Cognitive behavioural therapy, definitely.
Cognitive behavioural therapy allows the sufferer to identify, analyse and challenge their own irrational thoughts. I went to speak with CBT therapist Dr. Stephanie McLennan at a tranquil residential home in Reading to see why CBT can be so effective for sufferers of OCD. Hi, I'm really early, I'm Sam.
Oh, you Sam.
I'm
Hello,
so
Sam.
sorry, I'm
No,
really
that's
sorry.
all right. Do come in.
Do come in.
Don't worry.
Your cognitions determine your behaviour. Change your thoughts and you change your life. And they did some research with taxi drivers in London where they're developing their navigational skills, and that they actually did see that the neurons did actually change and strengthen. And yes, with thinking, with giving direction to the unconscious mind, it is believed that we do change the structure of the neurons, we strengthen them. However, I do believe it's important to introduce the therapy at an early stage and to recognise when OCD is developing.
The discovery that cognitive behavioural therapy could change a person's neurological brain activity gave further credibility to OCD having concrete neurological origins. And for Sasha, the idea that her condition could be linked to a physical impairment in her brain changed the way she was able to move forward with her condition.
Mummy, say, would you nice water?
Nice food.
One day I woke up and I was about 17 years old, and I just decided that I just didn't want to live like that anymore. It was just tiring and anxious feeling constantly. That is when I asked my mum if I could go and see a doctor about it, and we did. And the doctor immediately recognised it as OCD. It was really interesting hearing my doctor explain to me that I actually had a problem in my brain not firing right. It wasn't firing its neurons right, and I needed to replace those neurons with my medication, which was quite interesting for me to suddenly realise that what I had wasn't it wasn't just like a loopy mental thing. It was actually organic, and it was nice to hear that. Okay. Anything else you want to say?
In some severe cases, the therapy and drugs prove not enough. Dr. Linquist explains how a pioneering new surgery, gamma knife surgery, through severing the links between the neurons associated with the condition, is helping change the lives of many long-term sufferers of OCD.
This is a very successful case. This was a 17-year-old, very intelligent young man from Nebraska, and his obsession was to solve mathematical problems before he allowed himself to eat. So extremely sick. Before he had the treatment with the gamma knife, his parents had to force feed him to keep him alive. And when you use surgery for psychological disorders, is that they have additional pharmacological therapy and cognitive behavioral therapy before they're even subjected to gamma knife surgery. And this young man had been through all this, and finally he was treated with a gamma knife and was a very big success story. And he is now a doctor himself. And in fact, he was one of the first doctors that came to the aid of the people in Haiti after the earthquake. So that's a sunshine story.
I think too many people just go, oh, I'm really OCD about that, and they don't realise what OCD actually is. They think by kind of liking to have their perfume bottles in a row, they think they've got OCD. But that's not OCD. OCD is when you can't even... it stops your kind of ability to do your day-to-day things. That's when it's actually OCD. And I think people think that people who have got OCD are just these kind of freaks, you know, that go around with like plastic bags and, you know, like sit on the back of a seat of a bus and kind of murmur to themselves and rock backwards and forwards. However, probably, you know, their neighbour might have it, and you'll never know. I don't want people to judge me for being someone who has obsessive compulsive disorder. I just want to be Sasha, and that's who I want to be. I don't want to be labelled. Yes. Okay, come on then. You don't have to keep saying mummy. We'll just go. He has to be totally in control and charge. It's a familiar scenario.
Mommy!
No.
Mommy!